guys, it's Olivia. Welcome back to your endocrinology chapter. Now that we've gone through all of the different differences of sexual differentiation that you might be tested on for step 1, let's talk about how you would approach questions that are asking about a specific difference of sexual differentiation on step 1. So going back to our mnemonic here very quickly, remember the first column or the first number, if there's a 1 in that column, we are going to see elevated blood pressure. So the differences of sexual differentiation with elevated blood pressure will be anywhere where there's a 1 in that first column. So that would be 17 alpha hydroxylase deficiency or 11 beta hydroxylase deficiency. In 21 hydroxylase deficiency, you're actually going to see a decrease in blood pressure. There is no 1 in that first column, so you're not going to see elevated blood pressure. And then similarly, in 5 alpha reductase deficiency, you are not going to see an elevation in blood pressure. You're not really going to see a decrease. It's usually just normal or unchanged. And then the number that is in our second column or in the second place here is going to correspond to our androgens. If there's a 1 in that column, that is going to mean we have increased androgens. So we are going to see increased androgens in 21 hydroxylase deficiency. We are not going to see increased androgens. In fact, we are going to see decreased androgens in 17 hydroxylase deficiency because there is not a 1 in that spot. We're going to see increased androgens again in 11 beta hydroxylase deficiency and then decreased DHT in 5 alpha reductase deficiency. So this is a really helpful mnemonic that I think is a great quick and dirty way to approach these questions on differences of sexual differentiation on step 1. I think the next thing that's important to be aware of is how is this going to present in a question stem. So the next question that I kind of like to ask myself is who is going to be affected by this difference in sexual hormones. So for example, if we see increased androgens, that would be pretty abnormal in an XX patient, and subsequently it'll be an XX patient who has viralized that you are most likely to get tested on for step 1. Similarly, if we have decreased androgens or decreased DHT, that is going to be most important for XY patients who are most dependent on androgens and DHT for their sexual differentiation. And subsequently, those are going to be the karyotypes that you are most likely to get tested on step 1 for these differences. And then finally, the blood pressure and the potassium and sodium status can be a great way to differentiate between differences of sexual differentiation that may present with very similar karyotype and genitalia findings. For example, 21 hydroxylase deficiency can present in an XX patient with male or ambiguous external genitalia, no testes, and internal female genitalia on ultrasound. Similarly, 11 beta hydroxylase deficiency can also present in an XX individual with male or ambiguous genitalia externally, but no testes and internal female genitalia internally. And the key thing that's going to distinguish between these two enzyme deficiencies in a board-style question is going to be what's happening with the blood pressure. So in 21 hydroxylase deficiency, you'll have normal or decreased blood pressure if they're in salt wasting crisis, but in 11 beta hydroxylase deficiency, you're going to see an increased blood pressure. Similarly, the potassium will be increased in 21 hydroxylase deficiency, and the potassium will be decreased in 11 beta hydroxylase deficiency. Similarly, 17 alpha hydroxylase deficiency or 5 alpha reductase deficiency may also have a very similar presentation regarding the genitalia, female vagina ending in a blind pouch, and then undescended testes seen on ultrasound. The key thing that's going to distinguish between these two is going to be, again, the blood pressure and potassium status. So you're going to see increased blood pressure in 17 alpha hydroxylase deficiency, but you would see normal blood pressure or no impact on blood pressure in 5 alpha reductase deficiency. The potassium would be decreased in 17 alpha hydroxylase deficiency, and it would be again unchanged in 5 alpha reductase deficiency. So this kind of leads me into these 3 key steps that I want you guys to be thinking about when you are approaching questions about differences of sexual differentiation. And the first question that I want you to be thinking about is this patient XX or XY? And sometimes this will be given to you in the question stem. Sometimes they'll say this patient's karyotype is XX or this patient's karyotype is XY, but it's often revealed through the ultrasound findings. So this isn't always true, but a general rule of thumb that I like to think about when approaching these differences of sexual differentiation questions is that internal genitalia does not lie. External genitalia can be very misleading, it can be very confusing, but internal genitalia usually does not lie. So if you see testes on ultrasound or in the scrotal sac, that is going to be an XY individual, usually. If you see quote-unquote typical female internal genitalia, so uterus or ovaries on ultrasound, you should think this is an XX individual. And again, that is not always going to be true. Of course, there's exceptions to every rule, but for the purposes of step 1 and the purposes of differences of sexual differentiation questions, this is a very reasonable assumption to make and a great place to start analyzing this question. Once you have determined the karyotype of this individual, the next question you should ask yourself is what reproductive hormones are deficient or are in excess. So if you have an XX patient with male appearing external genitalia, that is going to be in excess of androgens, right? Because those androgens are what is making this female virilize, what is making this XX patient appear to have male appearing external genitalia. Similarly, if you see a female who is virilizing at puberty, excess hair growth, deeper voice, facial acne, that could also be a sign of increased androgens. Now for an XY patient, usually the problem is not too much androgens, but too little. So if you have an XY patient with female appearing external genitalia or indeterminate external genitalia, that is usually going to be due to either a decrease in DHT or a decrease in androgens in general. So for XX patients, if they have a difference of sexual differentiation, usually due to too many androgens. XY patients, because they're expecting to have androgens, if there is a difference of sexual differentiation, it's usually due to a decrease in androgens and or DHT. And then finally, the last question you should be asking yourself here are there any blood pressure irregularities? So as we discussed in your table earlier, if you see hypertension or decreased potassium, that could be 17 alpha hydroxylase deficiency or 11 beta hydroxylase deficiency. If you see salt wasting crisis, decreased blood pressure, and increased potassium, that is going to be pretty specific for 21 hydroxylase deficiency. And then if you don't see any blood pressure abnormalities at all, of course you could have a 21 hydroxylase deficiency that is not presenting with blood pressure abnormalities because that patient is not in salt wasting crisis. This could also be 5-alpha reductase deficiency, and I'll use a different color here just to highlight the fact that 5-alpha reductase deficiency will not be presenting with decreased blood pressure, even though either 5-alpha reductase deficiency or 21 hydroxylase deficiency could present with normal blood pressure. Okay, now let's use this template to go through some differences of sexual differentiation questions. The first question is, a G1P1 32-year-old prima gravida delivers a male infant at term. On exam, there are no testes present in the scrotal sac. Pelvic ultrasound reveals no testes, but does reveal what appears to be a uterus and ovaries. Temperature is 37 degrees Celsius, heart rate is 130, blood pressure is 105/69. What is the most likely cause of this patient's presentation? Okay, so working through our template here, the first question we're asking is this patient XX or XY? And remember, internal genitalia does not lie. So for this patient's internal genitalia, there are no testes, but there is a uterus and ovaries. So I am going to say that this patient is XX for the purposes of this question. Now, the question also classified this patient as a male infant born at term. So we know that the external genitalia is going to be presenting as male. If I have an XX individual with quote-unquote male-presenting external genitalia, I know that what causes that in an XX individual is going to be increased androgens. So I already know that in our first column here, this patient is going to have increased androgens. And because I know that this patient has to have increased androgens to make an XX individual have male external genitalia, I know that it's not going to be any of the differences of sexual differentiation where our androgens are decreased. So we're not going to be talking about 17 alpha hydroxylase deficiency in this question, and we're not going to be talking about 5-alpha reductase deficiency in this question. It could still be 21 hydroxylase deficiency or 11 beta hydroxylase deficiency. To differentiate between both of these two, we're going to have to go to our third step. Are there blood pressure irregularities? And certainly a neonate with a blood pressure of 105/69, that's a little hypertensive, and they would usually tell you that this was outside of normal range on step, so not really necessary to memorize all of the blood pressure parameters for neonates, infants, children for step 1. But we know that we do have a hypertensive infant. And going back to our chart here, we know that if you had 21 hydroxylase deficiency, your blood pressure would only be normal or decreased. So we would not see a hypertensive infant in this case, and that's going to rule out 21. But if we have 11 beta hydroxylase deficiency, you might see increased blood pressure. And that increased blood pressure here is going to help us distinguish between 11 beta hydroxylase deficiency and 21 hydroxylase deficiency and classify this infant as a patient with 11 beta hydroxylase deficiency. So that's how you would answer that first question. Let's try another one. Another question they could ask you is, a 14-year-old boy is brought to clinic by his mother for increasingly frequent episodes of dizziness and lightheadedness over the past week. Yesterday, the patient had to sit out of soccer practice because he felt like he might faint. On exam, there are no murmurs, rubs, or gallops, and breath sounds are clear in all lung fields. There are no testes present in the scrotal sac. Serum studies reveal hyponatremia and elevated renin levels. What is the most likely cause of this patient's presentation? Okay, so this question does not give us a karyotype analysis or ultrasound findings, so it's a little bit difficult to say if this patient is XX or XY right from the beginning. I do know that there's no testes in the scrotal sac, however, so I'm a little bit suspicious for a difference of sexual differentiation in this question. Starting with our third step here to analyze this question, it says that our patient's been having a lot of dizziness and lightheadedness over the past week. They also had to sit out of soccer practice. And then additionally, we know that they have hyponatremia, so decreased sodium, as well as increased renin levels. And then going back to our RAS pathway, if we have decreased sodium, it really seems like we are lacking in aldosterone or some sort of mineralocorticoid that is not allowing us to save the sodium we need. Additionally, if we have increased renin, it also seems like we don't have aldosterone around because aldosterone is not giving that negative feedback to stop renin from being produced. So given that we know that we have some sort of disruption and dysregulation of our RAS pathway and our patient is having this dizziness and hyponatremia, that is a great clue that we are talking about a patient with hypotension or salt wasting crisis in this question stem. Salt wasting crisis is pretty specific for 21-hydroxylase deficiency when we are talking about the differences of sexual differentiation. So I already have a high suspicion for this etiology, but I can kind of double check myself by going back and seeing, does this patient's genital presentation match what I would expect for this disorder? And here we have a male presenting individual who does not have any testes in the scrotal sac. We don't know really if they're present on ultrasound, but certainly it's a possibility that they are not present. And if this was an XX patient with salt wasting crisis, appearing male genitalia, but no testes in the scrotal sac, that is highly suspicious for 21-hydroxylase deficiency, and that is the answer I would choose on an exam. Now, I hope this video was helpful. I hope you feel a lot more confident answering these differences of sexual differentiation questions, and I'll see you next time.